me one characteristic that we'd look for in a line of people waiting to be decontaminated that would indicate that someone might have autism? What would be one thing we might notice that would be different? Repetitive motion, okay. A twirling of a pen, a twirling of a toy. What might you see? Flat faces. A flat, expressionless facial features. What else might you see? Excellent. Lack of eye contact. So when you think about the emotional connectedness, when you're talking to someone with autism who is looking out of the corner of their eye, who is not willing or able to look at you in the eye, whose facial expression is very flat, you might assume that they're defiant or they're drug impaired. They are more likely to withdraw with commanding direction. An extremely calm voice tone is necessary. There are people with a diagnosis of autism who teach. Certainly, full professors have diagnoses of autism. People with autism can have profound mental retardation, or they can have a very high IQ. You cannot assume if someone has a bracelet on that says autism, that that person will necessarily be cognitively disabled. So it's a spectrum disorder. There's a wide range of presentations, but there are communication difficulties with all, there are social functioning difficulties with all, and there are restricted repetitive interests or behaviors. Asperger's syndrome is one end of the spectrum of autism, and someone may say to you, I have Asperger's disease. They will not say I have autism. And Asperger's disease means they're very high functioning, but under stress you may see regression. So what I want to emphasize is that if someone has a caregiver, to do everything in your power to keep that caregiver with the person who has a diagnosis of autism. The person with autism may invade your personal space. They may prefer to be further away from you than is typical. Again, no eye contact. Very young people with autism often will do a lot of forearm flapping. So you'll see this forearm flapping, both excited, happy behavior, and anxiety. People with autism may not seem to take the situation seriously. And this is a problem when you have to move people forward. Some with autism are hypersensitive to loud noises or emotional voice tone. So use concrete phrases, speak directly. Use no more than one or two steps when you're trying to explain sequence of behaviors. Write it down on paper for them. It may help them focus. Avoid phrases that can be misinterpreted, such as knock it off or cut it out. Because again, knock it off to them may literally mean to remove a block from a pile, and cut it out would mean to cut around an object with a scissors. So a person with autism may interpret commanding language under stress. So if someone is repeating what you're saying, that does not necessarily mean they understand. With a person with autism, they may be insensitive to pain, especially under stress. So check for injuries. If possible, turn off sirens and flashing lights. Find a quiet location to talk. Avoid touching the person if possible. Explain what you're doing in concrete terms. And this is the most important thing I can tell you. For someone who has severe autism, use a role model. Have their caregiver go through decon first. Exaggerate the things you're doing with that caregiver. Go slow and move in a deliberate way when you're demonstrating decontamination. Be alert for the possibility of outbursts or impulsive, unexplained behavior. This, again, would not be defiant behavior. Autism is a brain disorder. There's cerebellar and limbic system damage. So if there are outbursts, for example, you may see someone with autism under stress beating on their own face. This, again, is something that you should be alert for, and if you're in a decontamination